Tell me about yourself and your professional experience.
My name is Mihiraa, and I am a registered nurse with 5 years of experience, primarily in surgical and medical nursing within a large tertiary care hospital in India. I hold a Bachelor of Science in Nursing from the University of Delhi, and throughout my career, I have developed a strong passion for providing holistic, patient-centered care. I am particularly skilled in acute care management, complex wound care, and leading patient education initiatives. In my previous role, I was a key member of a multidisciplinary team where I was responsible for a diverse patient caseload. I am highly proficient in adapting to new protocols and technologies, and I consistently focused on improving efficiency and patient outcomes. For instance, I took the initiative to streamline the patient handover process using a digital tool, which not only reduced communication errors, but also saved the team approximately 15 minutes per shift. While my foundational experience is rooted in the Indian healthcare system, I am well-versed in international nursing standards and best practices, as I've actively engaged in continuous professional development through online courses and seminars. My goal has always been to contribute to a healthcare environment that upholds the highest standards of safety and quality. I am deeply committed to a collaborative approach to care and believe that a positive team dynamic is essential for providing the best possible patient outcomes. I am confident that my clinical skills, combined with my dedication to continuous learning and teamwork, would allow me to make a meaningful contribution to your hospital and team.
Why did you choose a career in nursing?
I chose a career in nursing because I have a deep-seated desire to help others and make a tangible difference in people's lives during their most vulnerable moments. The human-centered nature of nursing, which combines compassionate care with evidence-based clinical skills, has always resonated with me. I was first inspired by a nurse who cared for a family member during a difficult time. I was so impressed by their professionalism, empathy, and ability to provide not only medical support but also emotional reassurance to my entire family. That experience showed me that nursing is more than just a job. It's a profound calling to serve. I am particularly drawn to the continuous learning and professional growth that a nursing career offers. The field is constantly evolving with new research, technologies, and best practices, and I am a strong believer in lifelong learning. My passion lies in becoming an advocate for my patients, ensuring their voices are heard and that they receive the highest standard of care. I am committed to a collaborative approach, recognizing that a positive team dynamic is essential for creating a safe and healing environment. Nursing provides a unique opportunity to connect with individuals from all walks of life, to learn from their stories, and to be a source of strength and comfort. For me, it is the perfect blend of science and humanity, and I can't imagine a more rewarding profession.
Why are you interested in this position and our hospital?
I am interested in this position and your hospital because my professional values and career aspirations align perfectly with your organization's mission and reputation for excellence. I have been following the work of your hospital for some time, particularly your commitment to evidence-based practice and patient-centered care, and I am deeply impressed by the innovative and collaborative approach you take to healthcare. This role in particular appeals to me because it offers the opportunity to specialize in a new area and work with a diverse patient population, which are two things I am passionate about. I'm also drawn to your hospital's culture of professional development and continuous learning. I am a strong believer in staying current with the latest evidence-based practices, and I see a clear commitment to supporting staff growth here. Your reputation for fostering a positive and supportive team environment is also very important to me. I am a highly collaborative individual who thrives in a setting where nurses, doctors, and other healthcare professionals work together seamlessly to achieve the best possible patient outcomes. In my previous role, I saw firsthand how effective teamwork can significantly improve patient safety and satisfaction. I am confident that my skills in critical thinking, communication, and patient advocacy would allow me to make a meaningful contribution to your team and help uphold the high standards of care your hospital is known for.
What is your understanding of the Australian healthcare system?
My understanding of the Australian healthcare system is that it's a comprehensive two-tiered system comprising both public and private sectors, with a strong focus on high-quality care and patient safety. At its core is Medicare, Australia's universal public health insurance scheme, which provides free or subsidized healthcare services to all citizens and permanent residents. I understand that Medicare covers services in public hospitals, as well as a range of services from GPs and specialists. I also recognize the important role of the private sector, which includes private hospitals and health insurance, providing patients with greater choice and flexibility in their care. I'm also aware of the key regulatory and quality frameworks that govern the system, such as the National Safety and Quality Health Service (NSQHS) standards. I understand that these standards are fundamental to ensuring consistent, high-quality care across all healthcare settings. For a nurse, this means a constant commitment to best practice in areas like medication safety, clinical handover, and infection control. I have actively studied these standards and feel confident in my ability to integrate them into my daily practice. Furthermore, I appreciate the collaborative and multidisciplinary nature of the Australian healthcare team, which includes nurses, doctors, allied health professionals, and support staff all working together for the best patient outcomes. I am eager to contribute to this collaborative environment and to uphold the principles of safety, quality, and person-centered care that define the Australian healthcare system.
Describe your previous hospital.
My previous hospital, a 500-bed tertiary care facility, was a bustling and dynamic environment that served a diverse patient population. I worked primarily in the surgical and medical wards, which provided me with invaluable exposure to a wide range of clinical cases, from routine post-operative care to complex, high-acuity patient management. The hospital was renowned for its commitment to patient safety and quality improvement, which was a core part of its culture. We had a robust system of daily safety huddles and regular audits, which encouraged every team member to be proactive in identifying and mitigating risks. The hospital also placed a strong emphasis on professional development and interdisciplinary collaboration. I had the opportunity to work alongside a diverse team of doctors, specialists, and allied health professionals, which taught me the importance of clear communication and shared decision-making. We utilized an advanced electronic health record system that streamlined workflows and ensured seamless information transfer between shifts and departments. This focus on technology and process optimization was a key factor in our ability to maintain high standards of care, even during busy periods. Overall, the experience taught me not only advanced clinical skills, but also the value of teamwork, continuous learning, and a proactive approach to patient advocacy. I feel this background has prepared me to thrive in a similar fast-paced and quality-driven environment.
Tell me about your previous role and responsibilities.
My previous role was a registered nurse on a busy surgical ward at a 500-bed tertiary hospital. My primary responsibilities revolved around providing comprehensive, patient-centered care from admission to discharge. This involved a wide range of duties, including medication administration, wound care, and managing complex patient cases with multiple comorbidities. A significant part of my job was also post-operative monitoring, where I was responsible for recognizing and responding to early signs of patient deterioration. Ensuring patient safety was always my top priority. In addition to my clinical tasks, I was deeply involved in patient and family education. I regularly taught patients about their recovery, medication regimens, and how to manage their conditions at home. I also played a key role in the interdisciplinary team, collaborating closely with doctors, physical therapists, and dietitians to develop and implement holistic care plans. For instance, I was often the first point of contact for families with questions, and I would communicate their concerns to the appropriate team members to ensure seamless care. I was responsible for meticulous documentation in electronic health record, which ensured continuity of care and accurate communication across shifts. This role not only strengthened my clinical skills, but also honed my abilities in teamwork, critical thinking, and patient advocacy, all of which I am confident I can bring to this position.
If a coworker is lazy and not doing the work, what's your action?
The primary concern in a healthcare setting is always patient safety. Therefore, if I were to observe a coworker who appeared to be lazy or not completing their assigned tasks, my first action would be to ensure that there are no immediate risks to our patients. My initial approach would be to address the situation discreetly and professionally, away from patients and other staff members. I would ask them an open-ended question like, "Is everything all right?" or "Is there something I can help with?" This provides an opportunity to understand if their behavior is due to a personal issue, feeling overwhelmed, or if they require additional support. It's important to approach the situation from a place of support and teamwork rather than accusation. If the behavior is a one-time occurrence, a simple conversation might be all that is needed. However, if the issue persists and it's clear their lack of effort is impacting patient care or placing an unfair burden on the rest of the team, I would follow the proper chain of command. My next step would be to privately inform the charge nurse or nurse unit manager. I would present the information factually and without personal judgment, focusing on the specific tasks that are not being completed and the potential impact on patient safety. I would not engage in gossip or complain to other colleagues, as this would be unprofessional and could create a toxic work environment. The goal is to find a solution that protects our patients and ensures the team can function effectively. My ultimate responsibility is to patient care, and I would take the necessary steps to make sure that is never compromised.
Describe a time you provided person-centered care.
Person-centered care is the cornerstone of my nursing philosophy, and I've had many opportunities to apply it. One instance that stands out involves an elderly patient named Mr. Thompson, who was admitted to our ward for a heart condition. He was generally quiet and withdrawn, and the medical team's plan was focused solely on his physical treatment. During my initial assessment, I noticed he seemed quite anxious and would constantly look at his watch. When I asked him what was on his mind, he revealed that he was a lifelong beekeeper and was worried about his hives, especially since it was the peak season. He felt disconnected and worried that his absence was causing harm to his bees. Recognizing that his emotional well-being was just as important as his physical health, I adjusted his care plan to be more holistic. I spoke with a physician about his anxiety and worked with a recreation therapist to find some articles and videos about beekeeping. I printed them out and brought them to him each day, which gave us a natural topic of conversation. This simple act validated his identity beyond being just a patient. We spent time talking about his passion, and his mood and demeanor visibly improved. He became more engaged in his physical therapy and showed a better response to his treatment. By focusing on his individual needs and interests, not just his diagnosis, we were able to alleviate his anxiety and contribute to a more positive recovery experience. This experience reinforced for me that truly effective care is about seeing the whole person, not just their illness.
Tell me about a time you had to manage a difficult or aggressive patient.
Handling a difficult or aggressive patient is a challenge every nurse faces, and it requires a calm, empathetic, and professional approach. A time that stands out for me involved a patient in the emergency department who was intoxicated and became verbally aggressive and uncooperative. He was demanding to leave against medical advice, and his aggressive behavior was escalating, causing distress to other patients and staff. My first step was to ensure the safety of everyone in the immediate area. I calmly asked other patients to move to a different waiting area and signaled to a security guard to be nearby, without making it obvious to the patient. Then I approached the patient with a non-threatening stance, maintaining a safe distance, and used a calm, low voice. I focused on de-escalation through therapeutic communication. Instead of telling him what he couldn't do, I validated his frustration by saying, "I can see that you're very upset right now, and I want to help. Let's talk about what's going on." I avoided arguing with him and instead offered him a clear choice. We can go to a quieter room to talk privately, or we can continue here, but I need you to lower your voice. By giving him a sense of control and respecting his autonomy, he chose to move to a private room. Once there, I was able to address his underlying fear and anxiety about being in the hospital. I provided him with clear information about his care plan and listened actively to his concerns. This de-escalation allowed us to safely administer the necessary care and for him to calm down without the need for physical or chemical restraints. The experience reinforced the importance of approaching every patient with empathy and a commitment to de-escalation as a primary intervention, even in the most challenging situations.
How do you manage your time and prioritize patient care during a busy shift?
Managing my time and prioritizing patient care during a busy shift is a core skill I've honed throughout my career, and my approach is both systematic and flexible. The first thing I do at the start of any shift is perform a thorough bedside handover and a quick initial assessment of all my assigned patients. I look beyond the basic reports to identify which patients have the most critical needs, such as those with unstable vitals, new admissions, or those requiring time-sensitive medication or interventions. This allows me to create a mental and, if needed, a written hierarchy of tasks based on a simple principle: prioritize the most unstable patient first. Once I have a clear picture, I use a staggered approach to my tasks. I group interventions together for efficiency, such as administering medications to multiple patients on the same round, or performing wound care and a physical assessment at the same time. While this structure is crucial, I always remain flexible and prepared for unexpected events. A sudden change in a patient's condition, a new admission, or an emergency will always take precedence. My priority list is a fluid document that I constantly reevaluate. I also rely heavily on clear, concise communication with my team. If I'm overwhelmed, I'm not afraid to ask for help, and I'm always willing to offer my assistance to others. This collaborative approach ensures that the entire team works together to manage the workload and, most importantly, provide safe, high-quality care to all patients.
Describe a time you identified a clinical risk or error. What did you do?
Recognizing and acting on a clinical risk or error is a critical part of a nurse's role in ensuring patient safety. A clear example of this happened during an evening shift when I was administering medication. I was preparing to give a patient their evening dose of an anticoagulant medication. As per my standard procedure, I performed a double check on the medication against the patient's electronic health record. My check revealed that the prescribed dose was significantly higher than the standard therapeutic range for a patient of their weight and condition. I immediately stopped the preparation of the medication. The first action I took was not to administer the drug, but to report the potential error. I promptly contacted the prescribing physician to clarify the order. During the conversation, I calmly and professionally explained my concern, referencing the patient's vitals, weight, and the standard medication guidelines. The doctor reviewed the chart and confirmed that it was a decimal point error in the order entry system, a potentially dangerous oversight that could have led to a serious adverse event. The physician immediately corrected the prescription to the correct, safe dose. I then properly administered the medication and documented the entire incident thoroughly in the patient's record and our hospital's incident reporting system. This ensured that the event was logged for quality assurance and that the rest of the team was aware of the change. This experience reinforced the importance of my role as a final safety check and underscored the value of meticulous attention to detail and commitment to following established protocols.
Give an example of when you demonstrated cultural sensitivity with a patient or family.
Providing culturally sensitive care is fundamental to my nursing practice. One instance that stands out involves an elderly patient from a South Asian background who was a new admission to our medical ward. When I performed my initial assessment, I noticed she was very reserved and appeared uncomfortable, particularly with a male nurse providing her care. She was also refusing to take her oral medications and eat the food provided by the hospital. Recognizing that her discomfort was likely due to a cultural difference rather than a medical issue, I knew I had to adjust my approach. Instead of insisting she comply, I first had a private conversation with her daughter. I explained my observations and asked if there were any specific cultural or religious practices we should be aware of regarding her care, diet, or personal space. The daughter explained that her mother was accustomed to being cared for by female nurses and that her diet was typically vegetarian and spicy, which made the bland hospital food unappealing. Armed with this knowledge, I worked with the charge nurse to rearrange our assignments so a female nurse could primarily care for her. I also consulted with our dietary team to see if they could prepare a more culturally appropriate meal. When the new food arrived, I personally brought it to the patient and explained that we wanted her to feel as comfortable as possible. This small act of respect and understanding made a profound difference. She began to cooperate with her care, took her medications, and her overall demeanor improved significantly. This experience reinforced for me that true patient-centered care goes beyond medical treatment. It requires a deep respect for a patient's cultural background and a willingness to adapt our approach to meet their unique needs.
How do you handle conflict with a colleague or another member of the healthcare team?
When a conflict arises with a colleague or another member of the healthcare team, my first priority is to address it directly and professionally, always keeping the patient's well-being at the forefront. I believe that open communication is the key to resolving any issue. I would never discuss the conflict with other colleagues or engage in gossip, as this only creates a toxic work environment and can compromise patient safety. Instead, I would respectfully ask the person to speak with me privately at a time that is convenient for both of us. During the conversation, my goal would be to understand their perspective fully. I would use active listening, avoid interrupting, and focus on I statements rather than you statements to prevent them from feeling defensive. For example, instead of saying, "You never checked the charts before a procedure," I would say, "I'm concerned that a lack of double-checking on our part could lead to a medication error." This approach focuses on the problem at hand, not on personal attacks. I would propose a solution collaboratively, seeking a compromise that benefits both parties and, most importantly, the patient. If the conflict is particularly difficult or involves a serious patient safety issue, I would not hesitate to involve our charge nurse or unit manager. Following the proper chain of command ensures that the situation is documented and managed appropriately. I firmly believe that maintaining a positive and respectful team dynamic is essential for providing high-quality care, and I am committed to doing my part to ensure we all work together effectively.
Tell me about a time you had to deliver difficult news to a patient or family.
Delivering difficult news is one of the most challenging but crucial aspects of a nurse's role. It requires both empathy and clear communication. A time that stands out was when a young patient, a teenager, was diagnosed with a chronic illness that would significantly change his life. The medical team had confirmed the diagnosis, and it fell to me, as his primary nurse, to assist the physician in informing the family. My role was to prepare the family for the conversation and to be a source of support afterward. I first took the parents to a private room, offering them some water and a moment to collect themselves. I used a calm and gentle tone to explain that the doctor would be coming in shortly to discuss the test results, reassuring them that we were all there to support them. During the conversation with the doctor, I stayed present in the room. I observed the family's nonverbal cues and emotional state. When the parents looked confused or overwhelmed, I would gently interject to clarify a medical term or to summarize a point in simpler language. I also made sure to give them space to react and ask questions, never rushing the conversation. After the physician left, I remained with the family. They were understandably emotional and had many questions about what the diagnosis meant for their son's future. I provided them with a quiet, supportive presence, answered their immediate questions about medication and care, and connected them with a social worker and a support group. My focus was on ensuring they felt heard, understood, and not alone. This experience taught me the immense importance of not just delivering information, but of providing compassionate support and resources to help families navigate through such profound and life-altering moments.
Describe a time you made a mistake at work and how you handled it.
In my nursing career, I've learned that mistakes, while rare, are inevitable, and how you handle them is what truly defines you as a professional. The time that comes to mind was during a particularly busy shift when I was administering morning medications. I had a patient with 2 different types of blood pressure medication, and in my rush, I inadvertently administered the wrong one first. I quickly realized my error during the final check of the medication chart. I immediately stopped what I was doing and took full responsibility. My first action was to ensure the patient's safety. I immediately checked the patient's vital signs, particularly their blood pressure, and monitored them closely for any adverse reactions. Thankfully, the error was caught almost instantly, and the patient showed no ill effects. My next step was to inform my charge nurse and the attending physician right away. I calmly and factually explained the situation, the medication I had administered, and the steps I had already taken to monitor the patient. This was not a time for excuses, but for accountability and honesty. Following the hospital's protocol, I completed an incident report, detailing the event, my actions, and what I believe contributed to the error, which in this case was rushing due to the busy workload. I used this mistake as a valuable learning opportunity. I proactively discussed it with my manager, and we agreed that I would take a moment before each medication round to perform a mental reset and double-check my work more deliberately. This experience reinforced the critical importance of a meticulous double-check system and taught me a valuable lesson in accountability and proactive problem-solving.
How would you respond to a patient who refuses care?
When a patient refuses care, my primary goal is to identify the underlying reason for their refusal and ensure their safety. I would never force a patient to undergo a procedure or treatment, as respecting their autonomy is a fundamental ethical principle of nursing. My initial response would be to take a moment and calmly speak with the patient in a private and non-confrontational setting. I would start by using open-ended questions like, "Can you help me understand why you don't feel comfortable with this treatment? Or what are your concerns about taking this medication?" This approach helps to build trust and provides a space for the patient to voice their fears, concerns, or cultural beliefs. Once I understand their perspective, I can provide the patient with clear, factual information about the risks and benefits of the proposed treatment, as well as the potential consequences of refusing it. I would use simple, non-medical language and, if necessary, use analogies to help them understand. For example, if a patient is refusing a blood test, I might explain how the information from that test is like a map that helps the doctor find the best path to their recovery. If the patient remains firm in their decision, then they have the legal capacity to make that choice. I would respect their decision and document it thoroughly. I would inform the rest of the healthcare team, including the physician, so that the patient's refusal is noted and alternative care plans can be discussed. However, if I suspect the patient's refusal is due to a lack of understanding, confusion, or a compromised mental state, I would involve the attending physician and a social worker to ensure that the patient's rights are protected while also addressing their medical needs. Ultimately, my responsibility is to advocate for the patient's well-being and ensure that their choices are both respected and informed.
Describe a time you worked under pressure.
In a high-acuity environment like nursing, working under pressure is a routine part of the job. One of the most challenging and memorable times I worked under significant pressure was during a night shift on a busy medical ward. We had just received 3 new admissions from the emergency department, all with complex needs, while a long-stay patient suddenly began to deteriorate. At the same time, the ward was short-staffed due to an unexpected absence. My immediate focus was to remain calm and systematic. My first action was to quickly assess the new admissions to get a baseline understanding of their needs, but my top priority became the deteriorating patient. I promptly initiated the rapid response protocol, which involved calling the medical emergency team and providing them with a concise and clear SBAR, situation, background, assessment, recommendation handover. While waiting for their arrival, I ensured the patient was stable, administered oxygen as per standing orders, and had all necessary equipment readily available. Simultaneously, I relied on my team. I delegated tasks to the other available nurse, asking them to complete the initial vitals and assessments for the new admissions. We communicated clearly and efficiently, providing brief updates to each other as we worked. We were a cohesive unit, and because we had a strong foundation of teamwork, we were able to manage the workload without compromising patient safety. This experience taught me that in moments of extreme pressure, the ability to remain calm, prioritize effectively, and trust in your team's capabilities is absolutely essential for providing high-quality care.
What is your understanding of the National Safety and Quality Health Service standards?
My understanding of the National Safety and Quality Health Service (NSQHS) standards is that they are a set of clear, concise, and measurable safety and quality standards that all Australian hospitals and healthcare organizations must meet. They are fundamental to the Australian healthcare system, serving as a framework to ensure that all patients receive safe, high-quality care. For me as a nurse, these standards are not just a set of rules, but a guiding philosophy that I integrate into my daily practice. I am particularly familiar with several key standards that are directly relevant to my role. The medication safety standard, for example, emphasizes the importance of a meticulous double-check system and accurate documentation to prevent medication errors. The comprehensive care standard highlights the need for holistic, person-centered care, ensuring that a patient's physical, psychological, and social needs are all addressed. I also understand that the communicating for safety standard is crucial, promoting effective handover processes like ISBAR to ensure clear and concise information transfer between healthcare professionals. In my daily practice, this translates to a proactive approach to patient safety. I consistently follow medication protocols, document every intervention thoroughly, and actively participate in team handovers. I am committed to continuous learning and staying updated on best practices to ensure my care is not only safe but also of the highest quality. My goal is to not only meet these standards but to exceed them, contributing to a culture of safety and excellence within the healthcare environment.
How do you ensure patient confidentiality and data privacy in your daily practice?
Ensuring patient confidentiality and data privacy is a non-negotiable ethical and legal responsibility that I take very seriously in my daily practice. My approach is centered on a few key principles. First, I strictly adhere to the need-to-know basis. This means I only access and review patient information that is directly necessary for me to provide safe and effective care. I would never access a patient's record out of personal curiosity or for any reason unrelated to my assigned duties. This is the first and most fundamental line of defense against privacy breaches. Secondly, I am vigilant about securing patient information in both digital and physical forms. I always log off from computer systems before leaving a workstation, even for a moment, to prevent unauthorized access. When discussing a patient's case with a colleague or a physician, I make sure to do so in a private area, such as a consultation room or a secluded corner of the ward, never in a public space like an elevator or cafeteria. This prevents any accidental disclosure to others who do not have a right to know the information. Finally, I'm proactive in educating patients about their privacy rights. I make it a practice to explain to them that their information is kept secure and that it is only shared with the healthcare team members directly involved in their care. This transparency builds trust and empowers the patient. My commitment to these practices is absolute, as I understand that a patient's trust in the healthcare system is built on the assurance that their most sensitive information is protected.
Describe your process for a comprehensive patient handover.
A comprehensive patient handover is a crucial and non-negotiable part of every shift change, as it ensures continuity of care and patient safety. My process for a thorough handover is systematic and follows the ISBAR framework, which stands for Introduction, Situation, Background, Assessment, and Recommendation. This structure ensures that no critical information is missed and that the receiving nurse has a complete picture of the patient's status. My process begins with the introduction, where I identify myself and the patient and then state the purpose of the handover. Next, I move to the situation, giving a brief, high-level overview of the patient's current condition and any immediate concerns. For example, this is Mr. Smith, a 65-year-old in room 203. He was admitted for a hypertensive crisis, and his blood pressure remains concerned. This is followed by the background, where I provide a concise summary of the patient's medical history, including relevant diagnoses, medications, and any recent procedures. I then move to the assessment, which is the most detailed part of the handover. Here, I report the patient's most recent vital signs, a head-to-toe system assessment, and any other relevant clinical observations, such as lab results or fluid balance. I also include the patient's psychological state and any pain management needs. The final step is the recommendation. I clearly state the care plan for the next shift, highlighting any upcoming tasks, such as specific medications, wound care, or new orders from the physician. I also invite the receiving nurse to ask any questions to ensure all information has been understood. This structured process guarantees that the next nurse is fully prepared to provide safe and effective care from the moment they take over.
What are the signs of a deteriorating patient, and what is your immediate response?
Identifying a deteriorating patient is one of the most critical skills a nurse must possess, as early intervention is key to a positive outcome. My understanding of the signs of deterioration includes a range of subtle to obvious changes across several body systems. These signs can include a change in vital signs, such as a dropping blood pressure, an elevated or very low heart rate, a significant change in respiratory rate, or a persistent fever. Other critical signs include altered mental status, such as increased confusion, disorientation, or a reduced level of consciousness. A patient might also exhibit a change in their physical appearance, like a pale or mottled skin tone, increased perspiration, or new signs of bleeding. It's not about one single sign, but about a cluster of changes that indicates the patient is no longer stable. My immediate response to a suspected deteriorating patient is guided by a clear, systematic process. First, I would conduct a rapid, hands-on assessment to confirm my initial observations and gather a full set of vital signs. I would then use a standardized communication tool like the SBAR framework, situation, background, assessment, recommendation, to promptly alert the medical emergency team or the attending physician. I would also ensure the patient is in a safe position and initiate any pre-approved standing orders, such as administering oxygen or positioning them appropriately to support their breathing. Throughout this process, I would remain calm and focused, continuously monitoring the patient for any further changes until the medical team arrives to take over. This proactive and systematic approach ensures that the patient receives the timely and expert care they need.
How do you stay updated on best practice guidelines and professional development?
Staying updated on best practice guidelines and professional development is not just a requirement, but a fundamental part of my commitment to providing the highest standard of patient care. In today's rapidly evolving healthcare landscape, continuous learning is essential for a nurse to remain effective and safe. My approach to this is proactive and multifaceted. I regularly read peer-reviewed nursing journals and publications, such as the Australian Journal of Advanced Nursing or international journals, to stay informed about new research and evidence-based practices. I also make it a point to attend professional development seminars and webinars whenever possible, both in person and online. These sessions are invaluable for learning about new technologies, treatment protocols, and changes in policy. For example, a recent webinar I attended on advanced wound care techniques completely changed my approach to managing pressure injuries, leading to better patient outcomes. In my previous role, I was an active participant in our hospital's in-service training sessions and clinical audits. I believe that learning is a shared responsibility, and these sessions provided a great platform for me to learn from my colleagues and share my own knowledge. I also use online resources and professional forums to network with other nurses and stay current on emerging trends. My commitment to professional development ensures that my skills and knowledge are always current, allowing me to provide the safest and most effective care to my patients.
What is your experience with electronic health records?
I have extensive experience with electronic health records, EHRs, which have been a central part of my daily practice throughout my career. In my previous role, we utilized a comprehensive EHR system, and I became highly proficient in all its core functions. I am skilled in using the system for patient admission and discharge, documenting patient assessments, administering and charting medications, and creating care plans. I understand that the EHR is not just a tool for documentation, but a critical component of patient safety, as it provides a centralized and real-time view of a patient health information, helping to prevent errors and improve coordination of care. I'm also well-versed in the importance of maintaining data accuracy and privacy within these systems. I know that meticulous and timely documentation is essential for continuity of care, and that I am responsible for the integrity of every entry I make. I am committed to following all privacy protocols, such as using secure passwords and always logging out of the system, to ensure that patient information remains confidential. In my experience, a well-managed EHR system is invaluable for a multidisciplinary team. It enables clear communication and efficient workflows, allowing me to spend more time at the patient's bedside and less time on paperwork. I am confident in my ability to quickly adapt to any EHR system your hospital uses, and I am eager to apply my skills to your team.
Describe a time you had to use your critical thinking skills to solve a problem.
Working in nursing, you're constantly faced with situations that require critical thinking. One time that stands out was with a patient who had been admitted for a routine hernia repair. Postoperatively, his vital signs were stable, and he seemed to be recovering well. However, during a routine check, I noticed a subtle but persistent change in his behavior. He was unusually restless and kept complaining of a vague, generalized discomfort, but he didn't report any pain at the surgical site. He simply said he felt off. Instead of simply administering a painkiller or a sedative, I knew I needed to look for the root cause of his change. I didn't rely on the initial diagnosis. I began to systematically reevaluate the patient's condition. I performed a full head-to-toe assessment, listening to his lungs and heart and checking for any signs of internal bleeding or infection. While his vitals were still within normal range, my assessment revealed a slight decrease in his oxygen saturation and a very faint change in his breath sounds. My critical thinking led me to form a hypothesis that the patient might be developing a pulmonary embolism, a potentially life-threatening complication. I immediately contacted the attending physician and provided a detailed SBAR, situation, background, assessment, recommendation handover. I recommended that the patient be evaluated for a pulmonary embolism, and the physician agreed. A subsequent CT scan confirmed my suspicion. Because of the early detection, the medical team was able to intervene quickly, and the patient made a full recovery. This experience reinforced the importance of not just treating symptoms, but of using critical thinking to connect subtle clues and anticipate potential complications.